My name is Sarah Tomney. I'm a paediatric ophthalmologist and I work in Temple Street and the Rotunda, and I screen the babies in the Rotunda for retinopathy of prematurity. Retinopathy of prematurity is a condition that affects babies born at less than 32 weeks corrected gestational age or 1,500 grams birth weight. The blood vessels at the back of the eye when the babies are born prematurely have not fully developed, and the babies can develop a potentially blinding condition where the blood vessels can lift off the retina at the back of the eye. The good thing about retinopathy of prematurity is that we know about it and we screen for it in all these babies. If the baby develops severe retinopathy of prematurity that requires treatment, there are a number of treatment options available to help save the baby's sight. Currently, I use a headset to examine the baby's eyes. This is a bright light which I wear on my head, and I use a lens to focus at the back of the eye. This means that I can see the back of the eye, but other members of the medical team can't. You can draw a diagram of this afterwards, but there isn't a record of the back of the baby's eyes following this. In many other units throughout the world and in the UK, we use retinal photography with cameras such as the RetCam to photograph the back of the baby's eyes and to screen for retinopathy of prematurity. As the babies need to have their eyes screened every 1 to 2 weeks, the camera would be used very frequently and used every week on the majority of the babies on the unit. It would allow us to have a record of the eyes and have a direct comparison each week when we're screening the baby's eyes, and also allow other members of the medical team to see the actual pathology and why it requires treatment. And also it would be very useful to be able to teach parents and to show them exactly what's happening with their baby's retinas. There are studies that show that using retinal photography is much less stressful for the infants than the indirect ophthalmoscope. And therefore, I think having this piece of equipment in the Rotunda would be hugely beneficial to the neonatal population that we look after.